Good morning. Good afternoon, students.
Good afternoon.
Good afternoon.
I'll show you or demonstrate about the kidneys. Kidneys are green-shaped organs. This is the lateral border. This is the medial border. Medial border is concave. Can you see this? This is the medial border. Medial border is concave in the middle for the structures which enter or leave the kidney. This is the upper pole. This is the lower pole. And this is the lateral border. The lateral border of the kidney, which is convex. Okay. Lateral border and medial border, you can identify, and you have to focus on the structures. Am I audible clearly?
Yes, ma'am.
Yes, ma'am. Structures at the hilum. What are the structures? Just now we have studied from before, backwards, front to back. What are the structures we come across? Yes?
Renal vein, renal artery, renal pelvis.
Yes. Renal vein is the first one. This is the renal vein. Then artery and the renal pelvis. The posterior most structure is the renal pelvis. This renal pelvis, it slopes downwards. It goes downwards. Okay. If you rotate it above, you'll alter the direction. Okay. And the pelvis becomes front. Okay, so this is not the anatomical position. First, you should see the lateral border, medial border, structures at the medial border. First one should be the renal vein, then renal artery. Numerous branches you can see because the renal artery will divide into segmental branches. Then the ureter, the renal pelvis behind. It's a dilated structure in the upper part. It continues downwards. There's a tube. This is the ureter, which will open into the bladder. Okay. See the structures from front to back at the hilum, and you see the surface. This is the anterior surface. This is the posterior surface. You can see. This is flat. This is flat. This is convex and irregular. Anterior surface is convex and irregular, whereas posterior surface is flat, which rests over the posterior abdominal wall. So you can differentiate. the anterior and posterior surface. Which side is it? As we have two kidneys, we have to determine the side. Which side is it? This is upper pole, lower pole. Structures at the hilum, renal vein, first one, anteriorly, renal artery, and renal pelvis behind. Then anterior, the rough surface, rough convex surface anteriorly, flat surface posteriorly. You hold like this. Then which side is it? Which side kidney is it? Yes?
Right.
Right. Okay, this is the right kidney. Now you tell me why this is not left kidney. I'll hold you the other way. Yes. You tell me why this is not left. Right kidney you should hold it in the right hand. Left kidney you should hold it in the left hand. Tell me why this is not left. Yes. How can you see? Why this
Content
is
of
not
hilum.
left? Huh? Yes.
Content of hilum.
Yes. This and the direction also. Here I have hold like the renal vein in front, artery, and the pelvis behind. The convex surface anteriorly and the flat surface posteriorly. Okay. Hold like this, but you can see the direction of the pelvis here. You can see the direction of the pelvis. It's going upwards. I am forcefully pulling it down. So this is not left side. And don't hold like this. This is a flat surface which should be present posteriorly. The anterior surface should always be convex and irregular. Posterior surface should be flat. Can see it in the lateral view. Okay. This is the anterior surface which is convex, and this is the posterior surface which is flat. Can you differentiate? Can you differentiate anterior and posterior surface? Yes or no? See, this is the left kidney. This is the anterior surface which is convex. This is the posterior surface which is flat. And the structures: renal vein in front, artery, then ureter. Okay, you should see the direction of the ureter, the pelvis. Vein, artery, and the pelvis. How do you differentiate renal vein from the renal artery? Yes. How do you differentiate vein from the artery?
Artery will be more muscular.
Thick walled. Veins are thin walled. Okay? You can feel the walls. Vein is thin walled. Artery is thick walled. Okay? You may get confused sometimes. Here, this is the vein. This is larger. And as I am feeling, this is thin. This is the artery. The artery is like they pass in the lower part in front of the vein and supply different segments. The renal vein, artery, and the pelvis. Okay. So for the anatomical position, you should see the structure at the hilum. You concentrate on the surface, convex surface anteriorly, flat surface posteriorly. It's how to determine the side of the kidney. Okay. Any confusion in this? Any doubt? The kidney is divided coronally to see the gross structure of the kidney, macroscopic structure of the kidney. The outer cortex, here you can see the outer cortex and medulla. Medulla is made up of pyramids. This is not that good section. You see some other specimens given during revision. The outer cortex and the inner medulla. Can you see the color difference? This is medulla. The outer part is the cortex. Cortex is thin with a cortical arch.
Ma'am, can't hear you properly.
Yeah, there's a construction going on. So I'll just show you. It's blurred also, no? Now, is it blurred? Can you see the color difference? This is the renal pyramid and this is the cortex. This renal pyramid will open into the minor calyx. This is the minor calyx. And we can see this. This is the pelvis. You can see 2 to 3 minor calyx, which will open, the minor calyxes, they will open into the major calyx, 1 to form the pelvis. These are the, like, this hole, can you see? It's a minor calyx. Minor calyx, minor calyxes, they join and form major calyx. Major calyx will form the ureter. And this is the renal sinus. This part is a renal sinus, which is occupied by renal, pelvis, perinephric fat. You can see perinephric fat. You can see little amount of perinephric fat also. Okay. You can see this properly when given for the revision. It's not visible that clearly now. Okay. Just understand the anatomical position. See the structures in the hilum, vein in front, artery, and the pelvis. See the direction. Kidneys, the upper pole you should hold near the midline, then the lower pole away from the midline. Okay, like this, obliquely. This is the anatomical position. Anterior surface convex, posterior surface flat. Okay, this is the anatomical position of the kidney. Okay, you should know about the posterior relations, important, and anterior relations. And the renal angle. What is renal angle? So this is about the kidney. Kidneys will be given for discussion. In the practical exam, kidneys will be given for discussion. That time you have to identify the side structures at the hilum. Okay? Yes?
Yes,
Any,
ma'am.
any doubts? This cross macroscopic structure you can see once you come here. During dissection hours we'll discuss. Okay? This will be given for revision again. That time you can see it clearly. By now you should be able to differentiate the sites, anatomical position. Okay, any doubts regarding this? Yes? Shall I conclude the session? At least answer for this.
Yes, ma'am.
Yes, thank you. Okay, I'll conclude.